Thank you very much. I'm here today with a number of healthcare workers, doctors, and other health leaders and some patients to highlight the potential impacts of the proposed budget that's working its way through Congress right now. So last month, House Republicans passed a budget blueprint that called for the Energy and Commerce Committee to find $880 billion in spending cuts. Now, Republicans have claimed that that is not a mandate to cut Medicaid. The problem with that logic is there's really only one place for the E&C committee to find $880 billion in spending cuts, and that is through Medicaid. Just yesterday, the House approved on a very narrow partisan divide the Senate's budget blueprint, which also calls for about $880 billion in cuts to Medicaid. And I want to just step back and highlight what they're doing right now, because there's been a lot of talk about efficiency, waste, fraud, and abuse. We know that there is not that much waste, fraud, and abuse in Medicaid or Medicare or Social Security. What is happening right now is that Republicans are looking to find $1.5, $1.6 trillion in spending cuts. This has never been about efficiency. It's never been about finding waste, fraud, and abuse. There just isn't that level of waste, fraud, and abuse in the federal government, in Medicaid or Social Security. What they're trying to do is cut so they can find $1.6 trillion in spending cuts to then partially pay for a $7 trillion tax cut, which, as we all know, is predominantly geared towards helping the wealthiest people in the world, including a lot of foreign investors. And this is just deeply immoral and outrageous. And the reason they're going after Medicaid is that Republicans have a basic math problem. And I hate to be the Asian guy talking about math, but the math just doesn't add up. There's not $1.6 trillion in the federal budget unless you start to look at programs like Medicaid and Social Security. That is what this is about. But we're here today to highlight the actual impacts of those cuts. $880 billion in cuts to Medicaid. What does that actually mean? I represent 136,000 constituents in this district in beautiful Orange County, California, that are on Medicaid. They risk losing their health care coverage if Donald Trump and House Republicans get their way. Importantly, this will impact a wide array of services, special needs, at-risk kids, kids in general. Over 50% of kids are on Medicaid in our district right now. 50% of the kids that are seen in the hospital behind me are on Medicaid. 60%, I believe, of the kids seen at Children's Hospital Orange County, we're going to hear from a doctor from CHOC in just a few moments, are on Medicaid. And that means that children's services are going to be closed down if these Medicaid cuts go through. Children's hospitals like CHOC across the state of California are going to be closed down if these Medicaid cuts go through. This is not just going to impact Medicaid patients, it's going to impact all of us who have children. It's going to deny us from getting health care, emergency health care for our kids, because our hospitals just can't afford to keep the doors open if these cuts go through. So the speakers that we're going to hear from today are going to tell us exactly how devastating these cuts are going to be. First, we're going to hear from Dr. Kate Williamson of the Children's Hospital Orange County. She's a board-certified pediatrician and the former president of the American Academy of Pediatrics in the Orange County chapter. She knows how essential Medicaid is to ensuring her patients receive the treatment that they need. Next, we'll hear from Joy Ann Fumera, a registered nurse at Kaiser Permanente, Orange County, and a member of the Orange County COVID-19 vaccine task force when that was in place. She's going to talk to us about how essential Medicaid is to keeping our hospitals open. And then finally, we're going to hear from Mercedes Mata, who is the mother of Dino, a 6-year-old brain cancer patient from Huntington Beach. Throughout his cancer treatment, Dino and his family have relied on Medicaid as their secondary insurance, as well as Medi-Cal's California Children's Service, which is funded through Medicaid. Look, I'm the father of 3 young kids myself, and I cannot fathom the idea that they would be denied health care coverage, also that we could fund a tax cut for billionaires. This budget is deeply immoral. It's going to have huge impacts on our economy. It's going to be the opposite of efficient, because at the end of the day, having healthy kids grow up to be productive members of society is important. It adds value. It creates an efficient and productive society. Taking away Medicaid will do the opposite. It will leave our future generations sicker and poorer. It is unconscionable, and we should be doing the exact opposite of this budget. We should be working to improve the lives of hardworking families, not slashing funding for children's health care. With that, I have the pleasure of introducing Kate Williamson.
Thank you, Congressman Min, for allowing me to be here. Again, I'm Dr. Kate Williamson. I'm a pediatrician at CHOC, and I also represent the American Academy of Pediatrics. I have been in practice for over 13 years, which is crazy how quick it's gone by, and my patients are the most amazing people who inspire me every day. And I want to talk to you about why any cut to Medicaid is incredibly devastating, not only to our children who are currently on Medicaid, but for all of our children in California. So Medi-Cal, which is the California Medicaid program, covers half of our California children, which is 5 million children throughout the state who are covered by this program. It is a very efficient and well-run program, and it is a lifeline to every child that it serves. And it includes so many important medical services for children, from medical to dental to vision to mental health services. That's from preventive care, seeing their primary care doctors, to urgent care, to ER visits, to hospitalizations. And in fact, 40% of California births are covered by Medicaid. That is nearly half of our babies who are born in hospitals and getting support in those first few days, which are so crucial, are covered by Medicaid. Any cut to Medicaid will harm every single child who is removed from that program, and in fact will harm every child in California because of the ripple effects that this will have on our state. This will harm kids with chronic medical conditions, whether we're talking about a kid with type 1 diabetes who relies on daily insulin just to survive, for newborns whose parents significantly depend on their pediatrician in those first few months just to keep their kids healthy and safe, and for kids who are healthy overall, but they get ear infections and they get broken bones and they need new prescription glasses just so they can see the board and get through that day at school. And as Congressman Min said, hospitals will close. This is absolutely true. Children's hospitals will close, and even adult hospitals who have children's services, we will absolutely see those close. And this is a huge detriment. They will close because the hospitals cannot afford to care for children who no longer have access to preventive care to keep them healthy in the first place, and who cannot afford to cover children who don't have insurance that covers any of the costs. Hospital closures by Medicaid cuts will harm all children in California, both who are currently on the Medicaid program and those who are not, because of all these closures of services. Healthy children means we have a healthy nation. If our children are not healthy, our nation is not healthy. They will miss school, they will not graduate, and they will not contribute to society. Our children are our future. A cut to Medicaid is robbing all of us of having a healthy future. We cannot afford destructive cuts to our children's health care. Please reconsider. Please do not cut Medicaid for our children.
Thank you, Dr. Williamson. Next up, we have Joy Ann Fumera, a nurse at Kaiser, part of the COVID-19 vaccine task force.
Thank you. Good morning, folks. My name is Joy Ann Fumera, and I'm a registered nurse here in Orange County and with UNAC UHCP. Me and my friends wanted to come out here and talk to you guys. Here in Orange County, we serve patients who rely on Medicaid in order to receive care every day. Right now, my patients are scared. Life is already so expensive, and cutting Medicaid means their families won't be able to afford the healthcare costs. There's no other option. Without Medicaid, they will not be able to receive the care that they need to remain healthy and productive members of society. Cutting Medicaid will make healthcare across the board more expensive too, because now we have to raise costs and force hospitals and community health centers to close and prevent thousands of people from being able to afford healthcare. Medicaid has saved thousands of lives here in Orange County. Medicaid keeps Orange County healthy and strong. And on a personal note, Medicaid saved my mom's life. So that is why we're here today. Thank you, Congressman Min, for bringing us together to protect Medicare.
Thank you, Joy.
Thank you.
Appreciate it. Our third speaker is Mercedes Mata, who'll speak about her son's experience. Thank you, Mercedes.
Hi, and I was contacted by the Pediatric Brain Tumor Foundation to come out here and speak, and I'm happy to be here because CCS for me means my son is alive. Over 40 million children are covered by Medicaid across the U.S., and over 1/3 of the children who are on Medicaid are being diagnosed with cancer, and that includes my son. I do have my own private insurance through Blue Shield, but it's not enough. The costs of all his care for the last 3 years, or going on to 4, would bankrupt me. And I don't know if my son would even be alive today if I didn't have the coverage that CCS provided us. Before insurance, I got a bill. It showed me that with 3 emergency room visits, the surgery, and then 2 weeks in the ICU, 3 days on oncology, was $500,000. Who can afford that? I'm a college graduate. I have a good job, but it doesn't matter. When it comes to these exorbitant costs, what do? Who are you going to rely on? If you cut these programs, children all over are going to be at risk, and surely it could be a death sentence for them. So please, I just ask that you do not cut Medicaid. It is not going to benefit anyone, and studies show that access to proper health care can actually reduce economic burden by trillions, $2 to $3 trillion. So it doesn't make sense to cut these programs. Thank you. Thank you.
Appreciate it. If you guys want to come back, I don't know if anybody has any questions for any of our folks who talked today, or myself. Dr. Williamson, Mercedes, would you like to come up? Joy, would you like to come on up? Are there any questions? And if not, we can go ahead and close, but I just want to emphasize again the real impacts that this is going to have. And this is just a very small cross-section, of course, of the broader impacts that this is going to have. There are many doctors out there, many hospitals that are going to be impacted, many patients, including kids who may die if these Medicaid cuts go through, many nurses and healthcare workers who just want to help those in need, want to help kids and folks who need healthcare. And that's what this is ultimately about, is how do we help those who need that help at a time of crisis in their lives? How do we get them the health care they deserve? So thank you very much. Appreciate it. Thank you to all the folks behind me for all the work you do in making our communities healthier and safer.